Hello there, my name's John McManus. I'm 70 years of age. I'm from Perth in Western Australia, and you could ask me why am I telling my story of healing hands. Some 5 years ago I developed a perianal abscess, and I had it lanced in 2017, and then periodically thereafter I had another 9-10 procedures to lance it, and ultimately ended up with a seep and drain after about 2 years. In the meantime, I'd had prostate cancer, so they had put off the surgery for treating the fistula, and I was under colorectal surgeon in Australia. And post the prostate cancer, which is all very successful and no problems, because of the time frame, the fistula had just got more complex. An MRI revealed that I had one abscess site and obviously a fistula and the blind fistula tract. So having had the seep and drain fitted, and being told after some 9 months by my colorectal surgeon that you would have to live with it, and I explained to him at the time that was non-negotiable because I lead an active life. I was still working, I like to jog and swim, and I just couldn't see that foreign part was going to assist me with my quality of life. And he said, well, basically you're just going to have to live with it. And I did explain to him the last meeting I had with him, it's non-negotiable. So from closing his office door, his surgery door, I started to look. And there was no pathway to healing hands. I would just say it was God or the universe directing me. And I started to research Kasar Sutra, which seemed to have very good results. And somehow or other, in October 2019, I stumbled across a YouTube of Dr Ashwin Porwal doing DLPL, and with laser, non-invasive, and all of a sudden my antenna's up and I am starting to get enthusiastic about this. So I researched it as much as I could, and then I got in touch with Dr Ashwin's wife, Dr Snehal, and at that time she was looking after any international inquiries. This was early October. I ended up being operated on the 31st of October in 2019. So it was fairly rushed, and certainly it wasn't a drawn out process. All my visa requests, my medical certificates were all completed seamlessly through Dr Snehal without a hitch, and I arrived in India on the 30th, had my operation on the 31st, and my first instance, I'd run out of money because my credit card was blocked for whatever reason. I came to the clinic, I was fairly dehydrated, and Dr Snehal made sure I had water. As simple as that. That was the beginning of my journey with healing hands and the values that depict this organisation. So I get my water. I got about 1,000 rupee from Dr Snehal, and I went back to the hotel. They instructed me to go back to the hotel, bring all my luggage here to Healing Hands. They arranged then my accommodation at the hotel where I'm currently staying, Sundarban, and previously stayed. And I was operated on that night. And the next thing I can remember is the beautiful Dr Ashwin Porwal coming into my room post-op saying, John, I can assure you, you are 100% cured. And that was a relief. No more seep and drain. I had to confirm that I didn't have the seep and drain. He said, no, you don't have the seep and drain. Now, for everybody who goes on this journey, there are moments of anxiety, lacking in confidence, stepping out from behind our protective covering and exposing ourselves to trust. And while I'd done as much research as I could done, I've spoken to people in Australia who'd had the procedure, and everything was positive. It then began my journey as a part of the Healing Hands family and the Fistula Warriors, as we like to now call ourselves, where I went through 6 weeks of healing here, and unfortunately I had a personal tragedy. I lost my grandson to suicide, and Dr Ashwin and Dr Porwal were just amazing through that time of grief. And I went home after about 6 weeks for his funeral and memorial, came back and proceeded on the healing process. And before I know it, COVID had hit. So I go back to Australia not fully healed, and then my story unfolds a little more complex in a manner. I developed an infection, and then to the rescue is Dr Ashwin Porwal. For 2 years, he has maintained contact with me via video, Zoom, with my GP, by messaging, so that I received a high level of care, and my partner, who would, along with my GP, would literally use the scalpel, open my wound up again, and probe it, clean it, flush it, and I'd go to the GP every 6 weeks, all under the tutelage of Dr Ashwin. Now, he did not have to do that. Western doctors would have just said more surgery. Dr Ashwin promised, he said, when you come back, I will treat you for free. And I can assure you, I don't care who knows, Dr Ashwin has been more than true to his word, has supported me, because the history of Healing Hands shows that DLPL, along with the follow-up, the extensive and diligent follow-up, Dr Ashwin has about 98.4% success, and this is proven over 2,600 cases. So I'm testimony to that, and so I came back here as soon as our borders opened, was treated the same day for the 2 fistula sites and tracts, and here I am 4 months later. Dr Ashwin was of the opinion that because of my history, he didn't want me to leave until such time as I was 100% cured. And he has told me today that I'm 100% cured. And I know that, and I humbly thank him from the bottom of my heart. And that allows me to help other people. I ask a lot of questions so that I actually have a little bit of education about fistula. But it's the staff here, and I point to my 2 attending physicians, Dr Ashwin Porwal and the beautiful Dr Manisha, who's my superheroine, who diligently treated me. I've counted, it's about some 50 times, and for follow-up, and have just been with me every step of the way, and taught me about no pain, no gain, breathe and pray, and the ultimate professionals about cleaning diligently, making sure that I attended to what I had to do, and assuring me all the way through that I'd be 100% cured. In the meantime, as a part of my journey, it seems to be while I'm here in India, but my partner had a subarachnoid brain hemorrhage, and that happened on the 14th of June. And so I contacted Dr Ashwin. My partner and I both agreed before I left Australia that if anything happened to either of us, we would continue on the task at hand, because I had to get cured. there's more to life than living with fistula because it's so debilitating. The support and love I got from Dr. Porwal, Dr. Manisha, Dr. Farhan, Dr. Lena, the lovely Dr. Pooja, and all the other staff, the power of prayer. My partner's made 100% recovery. She's in that 2% of all people, and I'm thankful to God. I'm thankful for all the prayers and love I've got from the staff here, and I can honestly say that this journey has been a gift from God, and the confidence, love, courtesy, professionalism that has come from all my great doctors. I can't thank them enough. The nursing staff, the pharmacy staff, and if I go through each of the doctors, what I've learned from them, if I start with Dr. Manisha. Dr. Manisha has taught me about the beauty of having a passion for what you do, always smiling, even when she's not feeling well. She comes in and smiles at me, and all the other patients as well. And first thing I ask how we're doing, and gets in and does the job at hand. A lot of people couldn't do it, and I've learned from her about that attention to detail and professionalism. Then we have Dr. Pooja. Now you think, what does Dr. Pooja do? Dr. Pooja, in my humble opinion, is the go-to doctor at Healing Hands. She looks after all the visa extensions. She looks after all the legals. She organises the cakes. She does the video blogs. And the one thing she taught me, she told me that her dad was very strict on her when she was studying about concentration. And when she's got a task, she concentrates meticulously on that. Dr. Lena, the other superstar here, she she introduced me to my favourite food, pa bhaji. I don't know if I pronounced that right, by the way, but she introduced me to that and kindly shared a meal with myself and Dr. Pooja. And I didn't know this at the time, but she does traditional Indian dance, and she'd invited several of our guests here, international guests, to go and witness her do that. And there's so much multifaceted ability to all the wonderful people here, but they all have a common value constitution that is about care, love, and professionalism. Their level of care is second to none. I can't think where you would get anybody praying for your loved ones or for your recovery. In Western society, it would be 6 weeks to your first follow-up, and then maybe another 6 weeks after that. And inevitably, you aren't cured. Here, 100%. So I implore anybody who is thinking about stepping off the bus, changing your life, getting your life back, as I have, and a lot of my fistula family, then please engage or reach out to Healing Hands and Dr. Ashwin Porwal and his team to get your life back on track. It's not that hard. Sometimes there's some tough days, there's no doubt about that, but nothing compared to the beast that is fistula and the angst that it causes to our families, ourselves, our quality of life. And so don't drink from the glass called depression, drink from the glass called courage, drink from the glass called confidence, and come and see these lovely people. I thank them from the bottom of my heart, and I wish you all well. You can contact any of us on the Fistula Lacebook support group, and we'd be happy to help. God bless you all, and have a successful healing.